Good morning. I am State Senator Mike Skindell, and it's a pleasure to have all of you folks here today at this press conference, press briefing about Ohio's healthcare exchange legislation. I will be speaking about the effort here in the Senate, and Representatives Antonio and Carney will be speaking about the effort in the House of Representatives. We will also have one individual, Carrie, who is going to be speaking about how she would be benefited by an Ohio healthcare exchange. First, I want to announce that on Tuesday this week, we introduced Senate Bill 277, which would establish Ohio's healthcare exchange under the Affordable Health Care Act. What is an exchange? An exchange basically is a marketplace where individuals and small businesses can purchase affordable private health care insurance. It creates an option for people to purchase health care insurance, and it makes insurance affordable. And irrespective of whether we have a federal Affordable Health Care Act or not, Ohio still needs to ensure it has a health care exchange to create that marketplace. I will say that Senate Bill 277 has its foundation in the work of a council established by former Governor Ted Strickland, which was the Health Care Coverage and Quality Council, and in particular the work of their Health Care Exchange Task Force. That task force last met in December of 2010 and has not met since that period of time. That task force made one primary recommendation, is that Ohio should have its own health care exchange and not rely upon a federally imposed health care exchange. In addition, the Health Care Exchange Task Force identified several principles that Ohio's exchange should contain, and that is maintained in our legislation. Senate Bill 277, and I don't believe the House yet has a number on it, but soon will. The companion House bill is consumer driven. It creates competition in the insurance industry to provide high quality and lower cost in purchasing health care. This legislature can no longer sit and watch idly as the Director of the Department of Insurance does nothing to establish a state health care exchange. This legislation is an opportunity for us to create a competitive marketplace for all Ohioans to purchase affordable health care insurance from a variety of providers. I will call upon the leaders of both the Senate and the House to start holding hearings on this exchange immediately. We are under a deadline. The states are to have their exchanges in place by the end of 2012. Otherwise, we may be forced to accept a one-size-fits-all exchange imposed by the federal government. In addition, there are some benefits by moving rapidly and establishing an exchange. We have waited actually too long already. If we would move more rapidly to set up that exchange, the state of Ohio could qualify for grants and other assistance from the federal government to help get the exchange up and running, and in addition to help improve our IT costs here in the state of Ohio. As a legislator, I have heard as far back as former Governor Bob Taft that in the healthcare arena at the state level and Medicaid, one of the areas that we need assistance with is IT, and it would provide much more efficiency and cost control. And we would be eligible for grants to help provide that IT assistance in establishing the exchange.